We all have a responsibility to help youth who are residing in out-of-home placements successfully transition to adulthood. There are many things that youth need to create a strong foundation for adulthood. One of the building blocks that youth need are making sure their health needs are being met. If youth are not maintaining their physical and mental health, it will likely affect their ability to be successful in many other areas of their life, such as keeping a job and going to school. According to Iowa Aftercare, of the youth entering their program, 92% reported having Medicaid. 64% reported having a primary care physician. Among females, 18% reported having an unattended pregnancy prior to accessing aftercare, and 21% reported having been referred for an alcohol or substance abuse assessment or counseling. So what's your role? What can you do with the youth? There are many ways you can advocate or assist youth with getting their health needs met. So what are some of the things that you can do to assist them? First, assess what the youth needs. Are they up to date on their immunizations, physicals, dental, and eye exams? Do they need to be seen by any specialists? If possible, help youth find and keep a primary care provider that can follow them ongoing. Has the youth had any mental health evaluations, or are they showing any behaviors that a mental health evaluation would be helpful? Make sure the youth's Medicaid or health insurance is current and active. Does the youth know how to and demonstrate good hygiene skills? If not, help the youth learn these skills and understand why it is important. Does the youth have access to and use birth control? Do they know about safe sex and pregnancy prevention? Second, if a physical or mental health need has been identified, consider the following. Make sure the team is aware of the needs and everyone is on the same page. Assess whether the current treatment methods are appropriate for the youth. Are they prescribed medications and are they working? Are there any side effects that need attention? Is the current level of care appropriately meeting the youth's needs? Make sure to respond to requests of information that would assist youth in qualifying for disability through Social Security. Has the youth been educated on their health needs? What does their diagnosis mean? Do they know what medication they are taking and why? If they have a qualifying diagnosis, connect them with Integrative Health Homes, IHH, who can begin working with them while they are in care to help make sure health needs are being met. Let's hear more about Integrated Health Homes and the services they offer.
My name is Kristen Atkinson. I am a team lead of an integrated health program, also known as the IHH. I'm here today to kind of just go over some of the IHH protocol and give you a little more insight on the background of IHH. The integrated health model first started in Iowa in 2013. And it is built on a medical home model designed to serve children with adults with mental health diagnosis or severe emotional disturbances. The IHH model uses a whole person philosophy to coordinate care for members in the areas of physical care, behavioral health, and social supports. This service is also voluntary and free to all members. So once a person is eligible and has successfully been enrolled into the IHH program, they will be assigned a team. First, the team will consist of a care coordinator, so that plays more of the social work role. They refer, they coordinate, and then they also oversee the CMH waiver and the habilitation waiver. You'll have a nurse care manager, so that person helps with like the medical and behavioral side of things, and then also tries to prevent those hospitalizations from happening. You have a peer support specialist that you find more in the adult IHHs. This person has experienced some sort of mental health diagnosis in the past, and they're in recovery, so they can identify a lot with a lot of our clients. And then you also have a family peer support specialist that works in the pediatric and also works in the adult side of things. And that person has had some of the children have experienced some sort of mental health issues. So they can also identify a lot with the family members like mom and dad and advocate at IEP meetings or DHS meetings. And IHH can offer assistance with coordination of options in areas such as, there's a really long list. We have housing, we have benefits, we have food stamps, WIC, any sort of entitled paperwork, transportation, payee or guardian, education. We can help connect them with a new psychiatrist or a therapist, BS, habilitation, problem solving and crisis management, reduction in hospitalizations and ER use, coordinations and support with school meetings, IEPs, DHS, JCOs, hospitalizations, substance abuse prevention, health promotion activities, any sort of legal issues, planning for life transitions, and connecting to various support group options in the community. I do want to emphasize, though, that an IHH does not deliver these services. We are here to coordinate and help with the service, and then once that funding is in place, that is when the service provider, would take over and help the client more one-on-one with those services. I also want to bring up the importance on why youth should be connected before they exit foster care. Many of our youth, once they turn 18 years old, really don't have anyone. So if they can be connected to an IHH at least 6 months to a year before, they can develop that relationship and that trust, either with that care coordinator or with that provider. So that really helps. I always like to explain what adult services look like is that we are more like an advocate or a mentor, meaning that once they're 18 years old, at least they get to create their own treatment plan. They're the ones that are running their treatment plan, and it's all focused on them and what they want to work on in the future. So I know that's really helpful for a lot of our transitional age youth to hear, because as soon as they hear services, they freak out and they don't want, services. So I always explain IHH services more as like a mentor or an advocate. Another bonus is that the IHH can help with housing and then finding those adult providers, a lot of them that are kind of in and out and don't really know where to go, and then also that entitled paperwork once they turn 18 and Social Security. In summary, this is where we really emphasize that you make that referral early. Earlier, the better, so we're not at the last minute and trying to find a place for someone to live within a month or two, because like I said, this takes at least 3 to 6 months. That's usually a 3 to 6 month process. So just be patient. Know that your IHH team is trying their hardest and that they will continue to support that youth until we can find them the proper place for them to live and live a successful life. Thank you.
Third, help set up services that can continue to address their needs in the future. Are there further assessments that need to be made? Does the youth need a current IQ test, including adaptive functioning level? Have they had a mental health evaluation in the last year prior to turning 18? Discuss the youth's intentions to continue their medications after they are 18 and they leave placement. If the youth doesn't intend to continue their medication, discuss with the team if it would be appropriate to wean the youth off their medication or do a trial run while they are still in the safety of placement. Will the youth be able to effectively manage their physical or mental health on their own? Are team members addressing the youth's needs for adult services, such as applying for waiver programs or rehabilitative services? As the youth nears age 18 or exiting care, make sure all necessary team members are at the table to address their health needs. Give youth opportunities to practice managing their health, such as knowing who their doctor or providers are and how to contact them. Let them make the calls to schedule and keep track of their own appointments. Have them be responsible for taking their medication or letting you know when they need to take it. One youth commented,
"Health insurance is a lot to learn and to take in. And I'm a visual learner, so something helpful would be a sheet that is highlighted with important information like my state ID number, my health insurance, and how to get my insurance cards, along with important numbers."
Resources to help the youth record this information are located in the tip binder. Discuss with the youth about when it is appropriate to go to the ER versus urgent care versus making an appointment with their primary doctor. Does the youth know about durable healthcare power of attorney? We are required to inform them that they can identify or appoint someone who they would want to be their healthcare agent, someone they can trust who can make healthcare decisions for the youth if they become too ill or injured to make them themselves. More information about this can be found in the self-care and health section of the tip binder. Youth who age out of foster care are eligible for EMIA, Expanded Medicaid for Independent Young Adults. This can continue till they reach age 26. They need to keep the DHS Income Maintenance Office aware of their current address and contact information so they can receive communication such as renewal letters and reminders. Youth Medicaid is provided by MCOs, Managed Care Organizations, contracted by the state. Here's more information about some of the services they provide that may be essential when assisting and preparing youth to manage their health needs when leaving care.
I'm Katie Sargent. I'm an employee with one of the managed care organizations. The Iowa Health Link program is currently administered by 2 contracted managed care organizations, or MCOs, which provide members with comprehensive healthcare services, including physical, behavioral, health, and long-term services and supports. The MCOs have a comprehensive network of healthcare providers that ensures quality care to all Medicaid members. MCOs are required to cover, at a minimum, all of the services that Iowa Medicaid currently covers. A key difference between the two MCOs lies in the extra benefits. You can find a side-by-side comparison of these extra benefits on the DHS website. MCOs offer case management and care coordination. These case managers and care coordinators can assist you with finding a new provider and identifying resources and referrals. They can assist with ensuring that members are aware of and able to access all of the benefits available to them. MCOs can ensure the unique needs of children in foster care are met. MCOs work to ensure continuity of care and consistency of services for children who have experienced complex trauma, especially those who are transitioning into the adult healthcare system. MCOs work in close partnership with Iowa Medicaid, child welfare agencies, and providers to support an interdisciplinary and member-centered approach to health and well-being. Youth exiting foster care can face numerous challenges. MCO case management services are voluntary and may benefit youth by identifying and helping to access necessary resources such as housing, community resources, employment, and physical and behavioral health care services. Assisting these youth with knowing what resources are available and where to go for help can be extremely critical for their success. MCOs can assist with helping members gain self-sufficiency and navigating the system with supports rather than alone. For example, MCOs can assist with transition from a pediatrician to an adult primary care physician. MCOs can also assist with coordinating and setting up transportation to and from Medicaid-covered services. MCOs offer improved access to physical and behavioral health care, increased continuity of care, increased care coordination and case management support, improved physical and behavioral health oversight. Providers can also assist youth by stressing the importance of annual Medicaid renewal dates and of notifying the Department of Human Services of address changes. To identify an assigned MCO, members may contact Iowa Medicaid Enterprise Services. Providers may contact the Eligibility and Verification Information System, or the ELVS line, with Iowa Medicaid Enterprise. You, as providers, have a critical role in assisting these youth as they journey to adulthood.
Thank you for working with our youth in foster care and taking the time to make a difference for each one of them. The transition planning specialist in your service area can be a resource for you. Feel free to invite the TPS to be a part of the team planning, especially when working with youth who have higher needs. We all need to work together to help these youth transition and build a stable foundation for adulthood.